Alright everyone, in this video I want to address the question of how to deal with a Class 3 malocclusion, also known as an underbite. An underbite is a situation where the lower teeth are out in front of the upper teeth, or said differently, the upper teeth are behind the lower teeth. Two options for dealing with that I would personally consider. MSE plus face mask and SFOT plus Invisalign. I would not consider AGA, even done safely, as an option for this, because SFOT plus Invisalign, if you want to avoid the face mask route, is going to be a much more robust and safer option in every respect, and I'm going to talk about that more in a second. First, MSE plus face mask. This is a correction of the Class 3 done at the level of the bone, which is always preferred. As we'll talk about in a second, SFOT plus Invisalign is dental. It's orthodontic in nature. It's tooth-borne. MSE, pop that sucker in, split that suture. While you're at it, regardless of the forward expansion, you get a ton of transverse expansion, which is left-right expansion. You blow open your nasal airway, you increase your tongue space, and you loosen the various sutures of the face, which allows you to then throw on a face mask. Now this is one type of face mask. It's my face mask of choice. Sorry, upside down. My face mask of choice. It's called the Crane, link in the description above. Why do I like the Crane as compared to, say, the Forwardontics Bow? Because the Crane applies no pressure to the face, whereas the Bow applies pressure to the forehead, which if you're going to wear something for 10 to 12 hours a day, I don't want that because I'm sensitive to pressure on my face and head. I will get headaches with that Forwardontics Bow. The Crane does not put pressure on the face at all. That's why I like it. Throw this on. It's easy, it's comfortable, it's not too constricting. It's expensive, but it's comfortable. Elastics from the Crane to the MSE or to TADS, or to hooks attached to the MSE, and then pull forward 10 to 12 hours a day. If you want it badly enough, if you've got the compliance, 6 months of that, I guarantee you your Class 3 malocclusion will be solved. But it's going to take compliance, and the face mask sucks. So are you going to be compliant? I don't know. I haven't been. You know, I haven't needed to be, truthfully. My upper is already too far in front of my forward, which is why I don't recommend MSE face mask for people in general for expanding forward. I recommend MSE for lateral, but forward is tricky, man. Forward expansion is tricky because you don't want to expand the upper forward without expanding the lower forward. That's not an issue for Class 3 patients, though, because their lower is already forward, so they only need to bring their upper forward. That's where the face mask is appropriate, in my opinion. And in fact, that's what orthodontists use it for, Class 3 patients. Before signing out, I want to talk briefly about SFOT plus Invisalign and why that's a better option than, let's say, AGA for dealing with purely expansion of the maxilla forward. Well, AGA pushes the front teeth forward. Yeah, you could expand that with that, but why would you push the front teeth forward with AGA into nothing, into no new bone, when you could do SFOT plus Invisalign, add bone, do corticotomies to allow those front teeth to move even easier, and expand into that new bone added during the surgically facilitated orthodontic therapy, aka SFOT. SFOT allows you to accomplish what AGA allows you to accomplish, but without the risk of pushing teeth out of the bone. SFOT is superior in every way, not to mention that SFOT is going to allow you to expand transversely too, because you're going to pack in bone on the sides of the upper and the lower. So, I'm still wearing the face mask. I don't need to wear that anymore. So, yeah, MSE face mask, SFOT Invisalign, that's what I would do. If I had a Class 3, which I don't, I have the opposite. I have an overjet now. Because, why? Because AGA expanded my upper forward without expanding my lower forward. It's the, it's the age-old problem. So, anyway, that's it for now. Thanks for tuning in. Let me know what else y'all want me to talk about. Be easy. Deuces.